It is the end of an era, the pandemic era.
Thank goodness.
Yeah, right. With that, though, it's the end of some pandemic era policies, including the National Public Health Agency.
Brendan Lewis with our Verify team looks into what that means for you and your health insurance moving forward.
After more than 3 years, the COVID-19 public health emergency is ending. So using these sources, we're answering some of your most common questions about what's changing. First, are at-home tests from the federal government still free? We verified that the government will no longer send you free kits through the Postal Service. And unless you're on Medicaid, insurance companies won't have to cover COVID-19 tests either. Some states and communities will continue giving away free tests. Next, will COVID-19 vaccines remain free? We verified that, yes, COVID-19 vaccines will remain free until the national supply runs out. It's expected to last through the summer. Once that happens, vaccines will remain free for the majority of people on private and public insurance. Finally, you may remember there were a lot of vaccine mandates during the pandemic. Do federal employees and contractors need to be vaccinated? We verified that no, after May 11th, federal employees and contractors are no longer required to get vaccinated. Private employers are still free to make their own rules about whether their workers need to be vaccinated.
The public health emergency also allowed doctors to prescribe controlled substances over telehealth, but that does change how the health emergency is ending. Will it? Among the rules the DEA relaxed because of the pandemic was that one that required you to see a doctor in person, only to get certain prescriptions though, like cough medicine, ADHD meds, and treatments for opioid abuse. That was scheduled to end when the public health emergency ends. But Tuesday morning, the DEA announced a 6-month extension after more than 38,000 people wrote to the agency. Why? Well, a few reasons here. The DEA says the extension gives patients and doctors more time to prepare for a potential change and make sure people have access to critical drugs. It also gives the government time to assess the change independent of other COVID policies.
All right, so this is the first spring in 4 years where COVID actually seems that it's actually in the rearview mirror. Many who have suffered more recently from COVID fatigue have hoped for someone to declare an end to this health emergency. Now it is official.
The reign of COVID began with the world under siege, the global pandemic killing nearly 7 million, infecting more than 750 million people, spreading fear and panic. On Friday, this from the World Health Organization.
It's therefore with great hope that I declare COVID-19 over as a global health emergency.
Is COVID over?
COVID is not over. There are still more than 1,000 people a week dying from COVID in the United States alone. We are definitely not out of the woods yet. All the advice that the CDC and others are giving about getting boosters, that applies. And I don't think that's a good idea for people to just say, you know what, out of sight, out of mind.
There's a new normal. It may mean no more COVID dashboards, no more White House briefings, but in its wake, more than 1 million Americans have died, an unimaginable toll. There have been more than 100 million cases, and while Americans no longer have to mask up, Dr. John LaPook warns not to let your guard down.
People who are vulnerable are still going to have to be careful, because if they get COVID, they could really have a bad outcome. I mean, the people who are vulnerable in our society tend to get left out.